I'm David Thomas. I'm chair of the Clinical Trials Expert Advisory Group for Canteen. I'm also director of the Kinghorn Cancer Centre and head of the cancer theme at the Garvan Institute of Medical Research.
So I'm Mandy Ballinger, I'm group leader here at the Garvan Institute of Medical Research. I am program manager for the Molecular Screening and Therapeutics program, and I look specifically after the adolescent and young adult MoST program. So rare and less common cancers disproportionately affect a younger population. In fact, around 70% of young people that are impacted by cancer have a rare or less common cancer type.
About 150 young people die every year within the adolescent young cancer group from cancer. And so to address this, the AYA MoST program was developed. It's a basket trial where it doesn't matter where the cancer started. It's the fact that you have an incurable cancer which makes you eligible for getting testing, which will then direct more personalised therapy. MoST stands for Molecular Screening and Therapeutics. The AYA MoST program is dedicated towards reaching, we hope, every young person who is fighting an incurable cancer diagnosis. Our goal is to reach out into the youth cancer service network that Canteen has supported throughout this country, and for any cancer patient between the ages of 15 and 25 who has an incurable cancer diagnosis to now make possible the testing of their tumours and the personalising of their therapy.
From a patient's perspective, we try and make the program as simple as possible. So firstly, it involves getting a referral from the patient's oncologist. The MoST team then gets in touch with the patient and has a discussion, explains what the program is about, answers any questions and gets consent from the patient to move forward. We then obtain a sample of the patient's tumour from a pre-existing sample that's stored at a pathology laboratory somewhere. We then analyse the patient's tumour. We look at the genomic sequence to see if we can identify targets within that tumour that might be suitable for treatments. The results of that analysis are discussed by a team of experts at a meeting called a molecular tumour board, and from that meeting a report is generated. That report is returned to the patient's oncologist, who then has a discussion with the patient to work out what is the best way forward.
Well, there are three possible options for a patient who has what we call a hit on their tumour sequencing. The first is that one of our own program's trials may be suitable. We're trying to cultivate a whole range of treatment options through clinical trials within the MoST program itself, which we would then refer the patient onto. And those trials are open at all of the youth cancer service centres throughout the country so that the patients don't have to travel for treatment. The second option is that we may identify a target for which we don't have a trial, but which may be available through a trial that is present throughout our network. And the third option is that treatments can be provided either by compassionate access, or in some cases when patients may have to even pay for treatments, that the oncologist may be able to access the drug for that patient even if a clinical trial isn't available. Our goal is to develop such a rich array of clinical trials that ultimately every person for whom we identify a target, we're able to connect them with what really matters, which is an effective therapy. We believe that no patient should die from cancer without having access to state-of-the-art research and clinical trials options.